Come on back. Craig, have a seat, my friend. If it's okay with you, we'll film you. If it's not, we won't.
I have nothing to hide. So
Okay. All right. What do we got for medical records? Do you have them with you?
Yeah.
Okay.
Let me see here. St. Pat's. And yeah, this is my last visit to Crown or Advanced Pain and Spine.
Craig, are we doing a renewal for you?
No, this is the first time.
Okay. A lot of back surgeries.
Yes. We were putting hardware in one time for a fusion. They broke off the pedicle when they were screwing a screw in, so they had to re-angle that screw, and it compressed a nerve root.
Ah, got it.
So I had
That's
to have
agony.
it in for a year, and then another surgery to take it out, hoping that they hadn't damaged that nerve that they ended up compressing. So
You ended up with a foot drop or anything like that?
yeah,
Yeah. Okay.
and I've got bilateral neuropathy in my feet. I can't feel my toes. I can't walk with thongs on or flip flops, because my feet doesn't feel that, and I end up either tripping myself or
Jamming your toes
Yeah,
and all
right.
that. Yeah, got it. All right, so how does cannabis help you? Helps you with pain.
yes,
Helps you with your tremor.
yes,
Helps you with your neuropathy. Are you on gabapentin or Lyrica?
Lyrica,
Lyrica.
150 milligrams twice a day.
Okay. All right, let's talk Lyrica. Lyrica has a side effect profile that hopefully we can avoid with cannabis. Okay.
Oh, okay.
100% of my cannabis patients came off Lyrica using cannabis.
Oh, really?
So this is why I'm sort of going to promote this idea to you. It's your choice, but basically Lyrica causes brain fog, memory loss,
I've got all those.
depression. It's affiliated with Parkinson's too. Some suicides, weight gain, not a problem in you.
No.
So big side effect profile, and maybe dementia. Now if you get dementia, you don't care, you won't remember that you have it, okay? But it's really hard on your loved ones.
Yes. Okay.
So if you want to come off it, you can. You might have to go slow.
Right.
Okay. You might have to, design in a really great cannabis program that doesn't leave you hanging when you're coming off the Lyrica, because people withdraw from it when they miss a dose. Have you noticed that?
Yes.
Yeah.
Yes.
So it's like that's a nice thing to be free from, because you don't want to really be on a medicine that you can withdraw from, because if you lose access to Lyrica, then you're in agony.
Right.
So. Cannabis is great for Parkinson's. I'm sure you've seen the videos of people with bad Parkinson's take some cannabis and then they're not shaking at all.
Right.
And that is a good thing with Parkinson's, because the Parkinson's medications, carbidopa, levodopa,
Right.
you're on that right now?
Yes, I am.
That has a limited utility. In other words, it works, there's only a certain amount of carbidopa, levodopa that's going to work for you. And after that, it stops working in the brain.
Oh.
So it's nice to slow down your use, so you need it later, you have it later.
Right.
So that's the great thing that cannabis can give you, is it help you with your tremor. You use less of the carbidopa, then it's available for you later when you need it more.
Right. Yeah, my tremor is really acting up today. I don't know why, but I have good days and bad days with that. And
Very common, very common.
I have trouble getting to sleep. I take Ambien to get me there.
Okay, well we can say goodbye to the Ambien, because cannabis can help you sleep. Ambien causes sleepwalking and sleep shopping and sleep driving. Okay, let's talk about steroid injections. I got some more space to write.
I think I might need one more, but
I'm going to hope to talk you out of it.
Okay.
Okay? Epidural steroids. Are you ready for a jaw-dropping conversation? They're not FDA approved. You already have kind of a failed back syndrome. I mean, you're basically 6 different surgeries and still in pain, and they're wanting to give you injections.
Right.
So, not FDA approved, and there's a rare side effect And I was thinking about this when you talked about your neuropathy in your feet.
Right.
You're not diabetic, right?
No.
You're not alcoholic.
No.
Okay. How'd you get the neuropathy? The epidural steroid injections.
Oh, really?
Rare side effect, and you can look this up. The rare side effect of steroid injections is a thing called adhesive arachnoiditis.
Sounds like related to the spider family.
Exactly. Let's talk about that. When they do the injection, they put the needle in this space. They put the needle through the arachnoid layer, which is a spidery thin layer,
Right.
above the dura, epidural. Okay? So the dura is a thick membrane that really feels solid when you pop through it. Okay? So they want to go through the spidery thin layer, but not through the dura. Okay?
Oh,
That's the epidural space. They inject a steroid into that space. This rare side effect comes because the steroid is designed to be absorbed slowly.
Oh.
So if it's absorbed slowly, that means how are you going to get a steroid to be absorbed slowly? So they bond it to a crystal, so that crystal slowly gives up the steroid over a 6-week period. Okay? And the idea is the steroid will cut down any inflammation on the nerve root that had the screw next to it.
Right.
Okay? So good idea. Steroids work in the elbow and in the knee and in the shoulder, but there's no nerve tissue in those areas. Okay? So they thought, well, if it works in all these areas, let's use it in the spine. So when you inject it into the spine area, if the steroid is absorbed and the crystal isn't, then you've got sand in this space.
Oh.
Okay?
Yeah.
And the sand could be an irritant. And if the arachnoid gets irritated, it's called arachnoiditis.
Okay.
And an inflamed surface that's irritated can be sticky, adhesive arachnoiditis. And the arachnoid sticks to the dura and spinal fluid can't flow. Now, once you have it, the temptation is to have more steroid injections because it's an inflammation.
Right.
The problem is you can't get the steroid where it goes because this is stuck together. So it won't work to do more steroid injections, and in fact, it maybe makes it worse. So why are they doing these procedures then if they're not FDA approved? Well, the FDA really regulates pharmaceuticals more than it does procedures.
Okay.
But the steroid is a pharmaceutical. So they should have gone through an approval process, and they didn't. And then it became popular, and then it became heavily reimbursed. And if your only tool is a hammer, everything looks like a nail. So if you're going to a procedural doctor, they're going to determine that, well, maybe if we use less pain medicine for people, maybe they'll have more procedures. So they're going to continue to offer these procedures. I think it's a kind of a risk. Now, it's a rare risk, but if you have 1 or 2 steroid injections and they work, okay. But if you have 30 in your life, your risk goes up because 30 times rare becomes infrequent. It's more than just rare.
Right.
So in Montana, they're doing a lot of these procedures. And a lot of our pain patients are getting worse instead of better because the benefit of the steroid injection is short. So you're going to have another one, and then another one, and then another one. And they limit you to 3 a year, but in 10 years, that's 30.
Right.
So this is a potential problem. I don't want to proselytize or recruit you to my way of thinking. I want you to go ahead and Google it, okay?
Okay.
And don't take my word for it. Do a little bit of your own research. You Google this, you'll probably say, I'm just going to use cannabis now. And that's why I'm glad you're here, so you can just switch over to cannabis, and then you're off the Lyrica, you're not getting steroid injections, you're using less carbidopa, you're going to improve your Parkinson's and your trajectory that way, you're going to improve your mood, your memory, you're going to be able to find your keys again, like that. All right, my friend, we'll copy a couple of these babies. You leave here with a packet, you'll take that to your cannabis provider, and you're good to go.
All right, that sounds great.
Welcome to the program.
All right, thank you, Mark. I appreciate
my
that.
pleasure. Yeah.